Question again. A patient with asthma is struggling to control symptoms despite using a rescue inhaler. As a healthcare provider, how would you integrate different treatment strategies to improve their asthma management? A. Increase the dose of the rescue inhaler. B. Add a long-term control medication. C. Review and adjust the patient's asthma action plan. D. Implement all of the above strategies. What's your answer?
Give me few hints.
Sure, here are some hints. Increasing the rescue inhaler dosage might provide short-term relief, but it's not a long-term solution. Long-term control medications help in preventing symptoms and managing chronic inflammation. An asthma action plan is a personalized strategy that outlines how to manage asthma daily and handle worsening symptoms. Integrating all these strategies provides a comprehensive approach to asthma management. With these hints, what's your answer?
Okay, sorry, I forget the four answer.
No problem at all. Let me repeat the options for you. A. Increase the dose of the rescue inhaler. B. Add a long-term control medication. C. Review and adjust the patient's asthma action plan. D. Implement all of the above strategies. Which one do you think is the best answer?
Sorry, I am not getting your point. Can you explain me in Urdu?
बिल्कुल। देखिए, इस सवाल में एक एस्थमा पेशेंट का जिक्र है जो अपने सिम्टम्स को रेस्क्यू इनहेलर के बावजूद कंट्रोल नहीं कर पा रहा। आपको एक हेल्थ केयर प्रोवाइडर के तौर पर एक साथ इस्तेमाल करके बेहतर एस्थमा मैनेजमेंट का प्लान बनाना है। ऑप्शंस ये हैं। ए. रेस्क्यू इनहेलर की डोज बढ़ाना। बी. एक लॉन्ग टर्म कंट्रोल मेडिकेशन शामिल करना। सी. पेशेंट के एस्थमा एक्शन प्लान को देखना और एडजस्ट करना।
Okay, now I
D.
got it. The correct answer is C.
Actually, the best answer is D. Implement all of the above strategies. ये इसलिए क्योंकि एस्थमा के बेहतरीन मैनेजमेंट के लिए सिर्फ एक स्ट्रैटेजी पर रिलाई करना काफी नहीं होता।
But I was
रेस्क्यू
thinking
इन
about the prioritization. That's why I select this answer.
That's a good point. Prioritizing treatment strategies is important. In this case, while increasing the dose of the rescue inhaler can be a short-term priority, incorporating a long-term control medication and reviewing the asthma action plan are also key elements in a comprehensive approach.